Why you get dizzy during your period and how to fix it. Feeling dizzy or lightheaded around your period can be unsettling. While it might seem like an unusual symptom, dizziness is something many people experience during their menstrual cycle. It's rarely a cause for serious concern, but understanding the potential links between your period and that woozy feeling is key to finding effective relief. Why dizziness happens during your period. Dizziness during menstruation, or in the days leading up to it, is often attributed to several physiological changes happening simultaneously. 1. Blood loss and iron deficiency anemia. For those with a heavy menstrual flow, menorrhagia, significant blood loss over several days can deplete the body's iron stores. Mayo Clinic, 2024, WHO, 2025. The mechanism: iron is essential for making hemoglobin, the protein in red blood cells that carries oxygen. When iron is low, the body can't produce enough hemoglobin, leading to iron deficiency anemia. The brain then receives less oxygen, which is a common cause of fatigue, weakness, and dizziness. Cleveland Clinic, 2024. The solution: consult a doctor and get a blood test, CBC plus ferritin, to confirm anemia before starting supplements. If confirmed, oral iron, e.g., ferrous sulfate, is first line. For iron may be needed for intolerance or severe cases. Pair iron-rich foods with vitamin C, e.g., spinach plus orange juice, to boost absorption by 2-3x, NIHODS, 2025. Avoid tea, coffee, or calcium-rich foods within 1 hour of iron intake, they block absorption. Two. Blood sugar fluctuations, relative drops, not true hypoglycemia. Hormonal shifts, particularly in estrogen, can influence the body's sensitivity to insulin and the stability of blood sugar levels. J. Clin Endocrinal Metab, 2020, Diabetes Care, 2024. The mechanism: estrogen fluctuations can cause relative drops in blood sugar, not usually true hypoglycemia, less than 70 mg per deciliter, in healthy people, but enough to trigger dizziness, shakiness, or brain fog, especially if meals are skipped or carb intake is low. Note: true hypoglycemia is effectively never caused by menstruation alone in healthy, non-diabetic individuals without prolonged fasting, greater than 24 to 48 hours, eating disorders, or medication interactions. The solution: eat small, frequent, balanced meals, complex carbs plus protein plus healthy fat, every 3 to 4 hours. For an acute episode, dizzy plus shaky 15g fast-acting carb, e.g., 4-ounce juice, glucose tab, plus protein/fat, e.g., crackers plus peanut butter, to prevent rebound. ADA, 2024. Most low-sugar dizziness is from dehydration or skipped meals. 3. Dehydration and electrolyte imbalance. Intense cramps, nausea, vomiting, diarrhea, or heavy bleeding can contribute to fluid and electrolyte loss. The mechanism: electrolytes, sodium, potassium, magnesium, regulate fluid balance, nerve signaling, and blood pressure. Fluid loss disrupts this, leading to orthostatic hypotension, dizziness when standing, muscle cramps, and fatigue. UpToDate, 2024, WebMD, 2024. The solution: hydrate consistently, aim for 2.5 to 3 L water/day during heavy flow. Use low-sugar electrolyte packets, e.g., Elementic Nun, liquid IV. Sugar-free, provide 500 to 1000 mg sodium. Any low-sugar electrolyte mix with similar sodium content works, brand examples for illustration only. Avoid coconut water as primary rehydration, high in potassium, low in sodium, not ideal for blood volume loss. Stand up slowly. Consider compression stockings, 20 to 30 mm of mercury, to prevent blood pooling in legs. Circulation, 2022. Limit caffeine and alcohol, both are diuretics and worsen dehydration. 4. Prostaglandin-induced vasodilation. High prostaglandin release during menstruation can affect blood vessels beyond the uterus. The mechanism: prostaglandins, especially PGF2-alpha, cause uterine contractions, cramps. In heavy cramping, they enter the bloodstream and act as vasodilators, widening blood vessels and temporarily dropping blood pressure, leading to orthostatic dizziness. Prostaglandins look at essential fatty acids, 2018, AJOG, 2023. The solution: NSAIDs, e.g., ibuprofen 400 to 600 mg, at the first sign of cramps block prostaglandin production, reducing both pain and dizziness. Take with food to protect stomach. Use for less than or equal to 3 days. Avoid if history of ulcers, kidney disease, asthma triggered by NSAIDs, or on blood thinners. Alternative: naproxen, Aleve, 220 to 440 mg, longer acting. Addressing electrolyte and blood sugar needs. When choosing a drink to combat dizziness, match the solution to the cause. Option: primary benefit. When to choose. Key caveat: low sugar electrolyte mixes, e.g., Elemental, NUN, liquid IV. Sugar-free. Replenishes sodium, potassium, magnesium with minimal sugar. Best for dehydration, heavy bleeding, cramps. Won't help if dizziness is from low blood sugar. Standard sports drinks, e.g., Gatorade, Powerade. Fast electrolytes plus carbs. Only if dizzy plus shaky plus confirmed low energy, suspected blood sugar dip. High in refined sugar, can cause rebound drop. Magnesium supplements, e.g., glycinate, 200 to 400 mg elemental. Aids muscle relaxation, supports hormonal balance. For severe cramps, take consistently, not just during period. Not a quick fix for dizziness, only helpful if deficient. Pro tip: low sugar is usually best. Use sugar-containing drinks only when dizzy plus shaky, suspected blood sugar dip. Comprehensive action plan for relief. Hydration first. Sip water all day. Add 1 low-sugar electrolyte packet, e.g., Elemental, if bleeding heavily or cramping. Stabilize blood sugar. Eat every 3 to 4 hours, oatmeal plus nuts, yogurt plus fruit, hummus plus veggies. Acute fix: 15 g carb plus protein, e.g., apple plus almond butter. Check your iron. Heavy periods. Get CBC plus ferritin. Only supplement if deficient, excess iron is toxic. Consider magnesium. 200 to 400 mg elemental magnesium nightly, e.g., 1, 400, 2, 800 mg magnesium glycinate, for cramps, sleep, and PMS mood support. J. Residential Med Sci. 2023. Best forms: glycinate or L-threonate 10-14% elemental mg, gentle, well absorbed, ideal for cramps and relaxation. Citrate 11-16% elemental, better for constipation, common with hormonal shifts or iron supplements. Check label for elemental mg content. Not a quick fix, benefits build over 1 to 2 cycles, though some notice cramp relief within 3 to 7 days with consistent use. Stand slowly. Sit on bed edge for 30 seconds before standing. Wear compression socks if dizziness hits when rising. Ease prostaglandin effects. Ibuprofen 400 to 600 mg at cramp onset, with food. Max 3 days, stop if stomach pain. Avoid dehydration triggers. Limit caffeine, coffee, soda, and alcohol during flow. When to see a doctor. Seek care immediately if dizziness includes fainting or near fainting, chest pain, shortness of breath, or confusion. Bleeding through a 1 pad/hour for several hours. Symptoms persist after your period ends. Severe headache with vision changes, blurring, flashes. Palpitations or irregular heartbeat. These could signal anemia, arrhythmia, ectopic pregnancy, or neurological issues. What your doctor may recommend for heavy bleeding, menorrhagia. Hormonal contraceptives, birth control pills, hormonal IUD, or progestin shots, reduce flow by 50 to 90%, preventing anemia and dizziness long-term, ACOG, 2024. Tranexamic acid, Listida, non-hormonal, reduces bleeding during periods. Iron infusion if anemia is severe. References.